Melanie. I'm going to be your nurse today. I'm going to be performing a head-to-toe assessment. What is your name?
Sarah.
Hi, Sarah. Nice to meet you. How are you doing today?
I'm good.
Good. And can you tell me what your date of birth is?
1401.
Okay, so that makes you 19.
Yep.
You do appear to be 19. And can you tell me what you do for a living?
I'm an LNA.
Oh, that's great. Do you want to be a nurse?
Yes.
Wow, that's great. And can you tell me what the date is today?
November 17th.
Perfect. So patient does appear to be alert and oriented. They know what time of day it is, where they are, and who they are. So would you say you've been having a good diet lately?
Yes.
Okay, and you haven't felt any sickness, anything wrong? Okay, and you do appear to be normal. You don't have anything obvious that I can see that would be wrong with you. No physical abnormalities. So I'm going to be performing a head-to-toe assessment today, and let me know if anything hurts you at any time, okay? Or if you have any questions. On a scale of 0 to 10, what would you say your pain is today? 0 being no pain at all, 10 being the worst pain unimaginable.
0.
Okay, good. So first I'm going to look at your hands. They do look pink. Skin is dry. Okay. I'm going to check for capillary refill. It is within 3 seconds. Checking for trigger. And that was normal, so that means you're hydrated. So first thing I'm going to do is feel around your scalp. Feel for any lumps or bumps. I do not feel any. Hair is well kept. It is clean. And I do not see anything wrong with that. Next, I'm going to feel around your ears. So they do look to be well cleaned. They are pink. They are warm to the touch. You do have earrings. Did those piercings heal nicely?
Yes.
Okay, good. And now I'm going to start testing for cranial nerves. First thing, can I please have you pull your face mask down? Okay, face contour does look good. Skin is normal color. And I do not see any abnormalities present. So if I can have you obstruct one nostril for me, I'm going to have you tell me what you smell.
Orange. Orange.
Okay. So cranial nerve number 1 does seem to be intact. Next, I'm going to have you tell me when you can see.
Now. Now.
Okay. So cranial nerve number 2 does seem to be intact. Next, I'm going to check your pupils. So just look straight ahead at me. Okay, so pupils are symmetric. They contracted and dilated as they were supposed to. So next I'm going to test for cranial nerves number 4 and 6. So if I can just have you look straight at me and have your eyes follow my finger. That's 6 of them. So cranial nerves 4 and 6 are intact. Sorry about that. And now I'm going to check for cranial nerve number 5. So I want you to let me know when you can feel something.
Now. 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 Now.
Perfect. So that shows me that cranial nerve number 5 is intact. And now I'm going to have you smile, frown, and show me your teeth. And then if I can have you puff your cheeks. Perfect. I'm just going to have you clench your jaw for me. Perfect. So that does show me that cranial nerve number 7 is intact. All right, and now I'm going to check cranial nerve number 8. So let me know when you can hear my gloves.
Now. Now.
Okay, cranial nerve number 8 does seem to be intact. So now I'm going to perform an oral exam. Alrighty, so I'm just going to have you say ah. Okay, patient did gag as expected, so that means that cranial nerve 9 is intact. And the uvula and palate do look normal. Your buccal mucosa does appear to be pink. Oral hygiene does look good. So cranial nerve number 10 is intact. And then if I can just have you, before you put your mask back on, if I can just have you stick out your tongue for me, and then say light, tight, dynamite.
Light, tight, dynamite.
Okay. So cranial nerve number 12 does seem to be intact. My hand since I was touching your mouth. Okay, last thing I'm going to test for cranial nerve number 11. So I'm going to have you turn your head towards my hand and shrug your shoulders. Okay? cranial nerve number 11 is intact. So all your cranial nerves are intact, which is great. So next I'm going to examine your neck. So I'm going to feel around for any lumps or bumps or anything abnormal. Okay, that does feel great. I'm going to check to make sure your trachea is midline. And it does appear to be midline. Now I'm going to feel for your carotid pulse. 2 plus. 2 plus. Now I'm going to listen with the bell of the stethoscope for any turbulence. Perfect. I did not hear any, so that is great. So next I'm going to move down to your thoracic area. So first I'm just going to examine and feel around. So skin is flesh color. I don't see any bruises, lumps, any bumps. I don't feel anything abnormal. So that is great. So next I'm going to listen for lung sounds. So every time I touch my stethoscope to you, if you can please breathe in and out. Let me know if you feel lightheaded at all. 2 more. Perfect. Okay. I did not hear any abnormal sounds such as stridor or wheezing. Now I'm going to move and do the same thing on your back. Okay, I'm looking again. I don't feel any lumps, bumps. I don't see any bruising or anything abnormal. Thoracic does seem to be symmetric. And now I'm just going to pinch right here and chest for symmetry. So if I can please have you inhale and exhale. And my bums did move at the same time, so your thoracic cage does appear to be symmetric. Next, I'm going to test for tactile firmness. So I'm going to feel for vibration. So every time I touch my palm to you, if you can say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. And I'm going to percuss around lung borders. Okay, so that did sound good, and it felt dull where I expected the lung borders to end. Now I'm going to do the same thing, so every time I touch my stethoscope to you, if you can please breathe in and out for me, I'm just going to listen to your breath sounds again. Perfect. And again, lung sounds did sound normal. I didn't hear any abnormalities like wheezing or anything. So next, if I can, I'm going to go back to the front, and I'm going to do some range of motion with you. So if I can please have you lift your arms up, put them behind your head, and then if I can have you put them behind your back, and then straight out. Perfect. So your shoulders, range of motion does appear to be good. And I'm going to have you flex your elbows, and then extend them, sorry. And then if I can have you rotate them, good. And then if I can please have you do flex, extend your, perfect. And then if I can have you twist them out, and make a fist, spread your fingers apart, and then if I can have you touch each palmar surface. Perfect. Good. So all upper extremity range of motion does seem to be performed well. So next I'm going to have you lay down, and I'm going to do your cardiac system now. First, going to have you turn to your left, and I'm looking for jugular vein distension. I do not see any, which is good. So first, I'm going to feel for an apical pulse at the fifth intercostal or midclavicular line. And I do feel it as 2+. So next I'm going to listen to your apical pulse for a full minute, okay? And your apical pulse was 82, which is normal. So that is great. And sorry. Next, I'm going to listen to all of your different valves of your heart. So first, I'm going to start with your aortic valve at the second intercostal, and your pulmonic at the second intercostal, and your tricuspid, second intercostal, and your mitral, second intercostal, midclavicular line. Perfect. So that all did sound normal, and now I'm going to do the same thing with the bell of the stethoscope. Aortic, pulmonic, tricuspid, and mitral. Perfect. And now I'm just going to have you turn to your side for me, and I'm going to listen for S3 and S4 sounds. And I did not hear any, which is great. I should not. Okay. So now I'm going to move down to your abdomen. So first thing I'm doing is I'm looking. The skin looks good. It is dry, warm to the touch, a good color. So now I'm going to listen for bowel sounds. So I hope you ate a good dinner for me. I'm going to start at the right lower quadrant. Another right upper quadrant. Left upper quadrant. And left lower quadrant. Perfect. And I did hear normal vowel sounds, so that is good. Now I'm going to listen for vascular sounds. Perfect. And I did not hear any, which is good. That is normal. And your umbilicus does appear to be midline. Next, I'm going to percuss. Perfect. And lastly, I'm going to palpate. So I'm going to do light palpation. Let me know if anything hurts, okay? Okay, I don't feel any lumps or bumps. Now I'm going to deep palpate, feeling for any swelling of your organs. And I did not feel any, which is good. So next I'm going to move down to your legs. So your legs do appear to be symmetric. Your hair distribution is normal. They are good color. I don't feel any lumps or bumps. I don't see any bruises. I don't see any scarring or anything abnormal. So I'm going to have you lift your leg up for me Perfect. Same with the other. And then if you can move it out towards me, same with the other. Bend your knee, lift your other leg, bend your knee, lift that leg. Perfect. And then if I can have you move your bended knee, in, and do the same with the other. Perfect. Thank you. So your leg range of motion does appear to be good. Next, I'm going to feel for your your posterior tibial pulse. And that is normal 2+. Now I'm going to take your socks off. I'm going to do a little ankle range of motion, but first I'm going to feel for your dorsalis tibial pulse. And that is strong 2+. And if I can have you push up on my hands, perfect, push down, move your ankles outward, inward, and then if I can have you wiggle your toes for me, perfect. So all of your ankle range of motion does feel good. Your toes, I'm going to check the nails do appear to be good, and I'm going to push down. And your circulation does appear to be good. Okay. And capillary refill is within 3 seconds. Sorry, I couldn't remember that word. Okay, I'm going to put your socks back on. Okay. Now I'm going to have you move to the edge of the bed for me. All right. And I'm going to have you put your finger on your nose and touch it to my finger. Perfect. So I'm just checking for cerebellar function here. Now, if I can have you touch your finger to each thumb, or your thumb to each finger. Perfect. And then this is what soft feels like, and this is what sharp feels like. So I'm going to have you close your eyes and tell me what you feel.
Sharp, soft, soft, sharp, sharp, soft, soft, sharp, 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 soft.
Perfect. For the abdomen, I would also look at the pen light, and I would look for any pulsations which were not present, and I just forgot to do that. Okay, next, if I can have you rub your heel to your chin for me. Okay. Thank you. And then if I can have you stand up for me, walk towards me, and walk back. And now if you can do heel to toe. Perfect. So your balance and coordination does seem to be intact. I'm going to have you stand right here, close your eyes, and I'm going to support you. This is the Romberg's test, and I'll perform this for 20 seconds to make sure that her balance is good and she is not falling. So I'm going to have you sit back down. And do you have any questions for me?
Nope.
No? Okay. And you're still not in any pain or anything, right?
Nope.
Okay. Thank you, Sarah, for letting me practice on you, and I hope you have a great day.
Thank you.